How does sickle cell stem cell transplant impact fertility? Imagine a treatment that could potentially cure sickle cell disease, but it might also affect your ability to have children. That's what happens with stem cell transplants for sickle cell disease. These transplants involve intense treatments called conditioning regimens, which prepare the body to accept new stem cells. These regimens often include chemotherapy and sometimes radiation. Unfortunately, these treatments can harm the reproductive organs, leading to fertility issues in both men and women. High-intensity conditioning treatments, like those using drugs such as busulfan and cyclophosphamide or total body irradiation, carry a high risk of causing permanent infertility. This is because they damage the ovaries or testes directly. Less intense or reduced intensity regimens might be gentler on fertility, but they can still cause temporary or lasting reproductive problems. Younger patients tend to have a better chance of preserving fertility because their reproductive organs are more resilient. People with sickle cell disease may already face fertility challenges. The disease itself can cause damage to reproductive organs, and treatments like hydroxyurea might lower ovarian reserve in women or affect sperm quality in men. So, before considering a stem cell transplant, doctors usually recommend fertility preservation options. For men, sperm banking is common and straightforward. For women, options include freezing eggs or embryos, and ovarian tissue preservation is also available, especially when time is limited. For young boys who haven't reached puberty, testicular tissue preservation is experimental and less widely available. After the transplant, some patients, especially those who received less intense conditioning, can conceive and have children. Studies have shown that about 45% of married women and men in some groups were able to conceive after transplant. However, many still face challenges like premature gonadal failure, which means their reproductive organs stop working earlier than normal. This is especially common with high-intensity treatments. Long-term fertility care is essential. Even years after a transplant, fertility can change, so ongoing monitoring and support are important. Every individual's experience varies based on factors like age, sex, the type of conditioning treatment, and their fertility status before the transplant. In summary, stem cell transplants for sickle cell disease can offer a chance for a cure, but the treatments involved often pose a significant risk to fertility. Fertility preservation options should be discussed before the procedure, and ongoing reproductive health support is vital afterward. If you or someone you know is considering this treatment, talking to a healthcare provider about fertility risks and preservation strategies is an important step.